Okay, I did my case study presentation on JW. So some background information. JW is a 78-year-old male. He is a retired firefighter and has experienced a lot of exposure to smoke and has had smoke inhalation over the years. He is married and has 2 children. He has 3 grandchildren. He loves history and watching documentaries. Medical history. In February of 2019, JW was rushed to the hospital after having an excruciating headache, experiencing impaired slurred speech, and some facial paresis. After he was admitted, it was found that JW suffered an ischemic CVA, affecting the posterior inferior frontal gyrus of the left hemisphere. Admission to Ahava Medical Center. JW was admitted to Ahava Medical Center on March 12, 2019, post-CVA for speech and language rehabilitative services. JW was receiving speech and language therapy for about a year and then stopped once the global pandemic hit in late March of 2020. JW then resumed his speech and language services at Ahava in February of 2021. Some characteristics that JW was presenting with post-CVA. He was experiencing a lot of difficulty producing and completing his sentences. He was lacking appropriate grammar structure and abilities. He had difficulty with repetition, difficulty naming objects, difficulty articulating some sounds and words, as well as difficulty writing. JW also presented with visible frustration, which his wife did mention a lot. She felt that he was just having a lot of difficulty getting out what he was trying to say and completing his sentences, as well as naming objects when she would show them to him, and he just couldn't do it, and he was very frustrated, and she was very concerned for him as well. Now, these characteristics are consistent with Brocas aphasia, which would be ICD-10 code 169.320. And this would be categorized as aphasia following a cerebral infarction because his Brocas aphasia was a result of his ischemic CVA or stroke. JW actually received the diagnosis of Brocas aphasia at the hospital, and Brocas aphasia has a few hallmark characteristics, which are impaired speech production, relatively spared but not necessarily normal auditory comprehension, as well as agrammatism. Brocas area can be known as the seat of articulate language, and therefore damage to Brocas area leads to the characteristics commonly seen in Brocas aphasia. And these characteristics were seen in JW as well as consistent with the site of lesion that he experienced. Speech and language and cognitive evaluation. A formal evaluation was conducted at Ahava Medical Center. The Western Aphasia Battery Revised, also known as the WAB, was administered to JW. The WAB is a formal battery that contains various subtests that assess various linguistic skills and communication modalities. The subtest scores can then be used to calculate an aphasia quotient. The aphasia quotient then indicates and lets us know the level of severity of the aphasia that the individual is presenting with. So JW actually received an aphasia quotient of 51, which is indicative of moderate Brocas aphasia. So aphasia long and short-term goals, which I did feel were appropriate. The long-term goal was that JW will increase expressive language skills in order to engage in functional communication with familiar and unfamiliar speaking partners. Short-term goals. Number 1, JW will generate a simple sentence containing 3 or more words at the simple conversation level with a familiar speaking partner with 75% accuracy and minimal verbal cues. 2, JW will increase ability to name objects pictured in a photograph using SFA technique with 80% accuracy and minimal phonemic cues and visual aids. 3. JW will name 2 common objects given through picture stimuli, a thematic structure like found in a kitchen, and a field of 3 with 80% accuracy and minimal phonemic cues. So at the time that these long-term goals were generated for JW, my supervisors at AHAVA took the whole patient approach, and they strongly took into consideration the priorities of JW's wife and himself, and as well as, of course, his needs, and wanted to create appropriate goals addressing his deficits. So again, his wife did mention frequently that she felt he was having a really hard time producing and completing his sentences, and therefore the goal of generating a simple sentence containing 3 or more words at the simple conversation level was generated. And again, this of course addresses a deficit that he was experiencing, but as well taking into consideration the priority and concerns of his wife. Same with the naming goal, which she expressed frequently that this was an area of concern for her and him as well. So they did take the whole patient approach in creating these short-term goals and long-term goal for JW. What we did in therapy. So in therapy, we used the semantic feature analysis technique with JW. And SFA is a frequently used treatment for individuals with aphasia, including Brocas aphasia. SFA is used to improve naming and expressive language abilities. SFA provides an organized method of activating an individual's semantic networks. And what it is a systemic cueing method that's being used where the patient is asked to produce words semantically related to the target word. So for example, if I show someone a picture of a hammer, now the patient can be asked to produce semantically related words to that picture of the hammer. So, for example, how is it used? Where can we find it? Can you tell me some properties? Describe it for me, etc. And actually, in a study of an article that I read, SFA was used to treat various types of aphasia, and generalization of treatment and positive gains were found most in the individuals with Brocas aphasia. So during our sessions, a picture of an object would be placed at the center of the graphic organizer that's shown at the upper right-hand corner. And then JW would be asked to name the object in the picture. So again, using the hammer example, I'd place a picture of a hammer right in the middle. And then if JW could not name that object, the questions around the picture would be asked to help him name it. So we'd say, okay, well, use, what can you use it for? Or action, what does it do? Properties, can you describe it? Location, where can you find it? And association, it reminds me of what? What does it remind you of? And if at times JW still could not name the picture, I would have him just repeat after me. And we did do this for multiple trials during our sessions. And during my time with JW, he did make a lot of gains in naming, and he's still continuing to use SFA as I was last updated. He still needs to continue making progress and continue working towards his goals, but it was working for him, and he did make a lot of gains while I was with him. So like I said, he made significant progress toward reaching his goals. However, he's still receiving speech and language therapy services at AHAVA Medical Center to continue his progress. And as I was last updated, he is still receiving speech and language therapy twice weekly, and he's very much motivated and working hard with his new student clinician, and I do wish him all the best, and I wish him continued progress and happiness for him and his wife, and I hope this continues to work for him. And that is it. These are my references, and that is the end of my presentation. Thank you so much.